Imagine signing a lease for an apartment that costs over $60,000 a year. It doesn't include daily care, and if you need help tying your shoes, rent goes up. Welcome to assisted living in America. It is a booming, multi-billion-dollar real estate industry built on a quiet premise, outliving your ability to safely make a cup of coffee. We will look at how this market is designed to drain a lifetime of savings. Before the 1980s, if an older American couldn't safely live alone, they had two options. They moved in with adult children or went to a nursing home. Nursing homes back then were highly institutional. They looked and felt like hospitals with linoleum floors and strict schedules. But as the population aged, a gap appeared. What about people who didn't need around-the-clock medical attention but couldn't manage stairs safely? Enter assisted living. The idea was revolutionary. Combine the privacy of an apartment with the safety of on-call staff. You get your own door, but there is a dining room down the hall. Over the last 30 years, this transformed into a gold rush. Developers realized older adults sitting on home equity would pay a premium to avoid the clinical feel of a nursing home. Today, assisted living sits in the gray area between hospitality and healthcare, but legally and economically, it leans toward real estate. It was designed to offer autonomy and dignity. But because it was built as a private market solution rather than a public health entitlement, it evolved to serve mainly the upper middle class, creating an industry operating with remarkably little federal oversight. Let us look at the numbers. If you Google the average cost of assisted living, you will see a figure around $4,500 to $5,500 a month. According to the widely cited Genworth Cost of Care Survey, the national median sits roughly between $53,000 and $64,000 a year. But that number is highly deceptive. It is just the base rate. The base rate gets you in the building. It covers your room, basic utilities, dining room meals, and light housekeeping. It does not cover the actual assisted part of assisted living, which is where families get caught off guard. Most facilities operate on a tiered pricing model. Do you need help taking a shower? That is an extra fee. Do you need someone to hand you your pills twice a day? Another fee. Need an escort to the dining room? Add it to the bill. Depending on the facility, these additional care levels easily add $1,000 to $3,000 to your monthly baseline. Geography matters immensely. In the South, you might find a base rate of $4,000 a month. In the Northeast or California, that same base rate easily starts at $7,000, often climbing higher depending on the zip code. Then there is memory care. If a resident has Alzheimer's, they require a secure unit with specialized staffing. Memory care is priced separately and usually costs roughly 20 to 30% more than standard care, pushing the national median closer to $7,000 or $8,000 a month. And remember, these are recurring charges. Almost every facility charges an entrance fee. This non-refundable payment ranges from 1 month's rent to tens of thousands of dollars simply for the privilege of signing the contract. Add it all up, and a resident staying 3 years easily generates well over $250,000 in total revenue for a single facility. This is a staggering amount of money for any family to bear out of pocket. To understand where all that money goes, look at who owns the buildings. You might walk into a facility named Sunrise Meadows and think it is a local, independent community. But the reality is that the assisted living industry is heavily consolidated, dominated by massive corporate players. There are three main forces at play: operators, real estate investment trusts, and private equity. Often, the company managing the care does not actually own the building. The real estate is frequently owned by a real estate investment trust, or REIT. These are massive financial entities that buy properties and lease them back to the care operators. For the REIT, an assisted living facility is a fantastic asset, yielding much higher rent per square foot than a standard apartment complex. The care operator pays the lease to the REIT, and to make their own profit, they must keep operating margins incredibly tight. The biggest operating cost in assisted living is labor. This is the fundamental tension in the business model. You have an industry charging luxury hotel prices, but it relies on a workforce making wages that often hover barely above minimum wage. The caregivers, medication aides, and dietary staff, the people actually providing hands-on care, are rarely making middle-class salaries. Turnover is notoriously high, sometimes exceeding 70% a year because the work is physically demanding and poorly compensated. So the money flows upward. The family pays $6,000 a month. A large chunk goes to the corporate operator. The operator passes a significant portion to the REIT in rent. The remainder is squeezed to cover insurance, food, utilities, and a pool of low-wage workers. Recently, private equity firms aggressively entered this space. Their model is to buy a struggling facility, cut operational costs to improve the margin, and sell the asset later at a premium. When private equity takes over, families often report sudden spikes in fees. The industry lobbies fiercely at the state level to avoid strict minimum staffing ratios, because the moment you mandate a higher ratio of nurses to residents, those lucrative profit margins completely collapse. Here is a dangerous misunderstanding in American retirement planning. People assume Medicare will pay for this. It will not. Medicare is the federal health insurance program for people over 65. It pays for doctors, hospitals, surgeries, and short-term rehabilitation. It does not pay for room and board, nor does it pay for custodial care, the industry term for help with daily living activities like bathing and dressing. If you move into assisted living simply because you are frail and need help, Medicare contributes absolutely zero to your monthly rent. So, who pays? You do. The vast majority of assisted living is paid out of pocket using private funds. This is where the American middle class systematically liquidates its wealth. Families drain savings accounts, cash out 401ks, and sell the family home to pay the monthly bill. Some people have long-term care insurance, which can be a lifesaver. But those policies are expensive, difficult to qualify for, and heavily capped. Many insurers underestimated how long people would live and have aggressively raised premiums or exited the market entirely. What about Medicaid? Medicaid is the joint federal and state program for low-income Americans. It does pay for long-term care, but it was historically designed to pay for nursing homes, not assisted living. In some states, Medicaid has waiver programs that will help cover the care portion of an assisted living bill, but it almost never covers the room and board. Furthermore, assisted living facilities are not required to accept Medicaid. Many simply refuse it because private pay residents are far more profitable. Even if you find a facility that takes a Medicaid waiver, you must spend down nearly all your assets, usually leaving you with less than $2,000 in the bank before the government steps in. The base rent and care tiers are just the visible part of the iceberg. The hidden costs in assisted living are buried deep in the contracts, and they operate like a financial trapdoor. First are the annual rent increases. Unlike standard apartments where a state or city might cap rent hikes, assisted living facilities routinely increase their base rates by 5 to 8% every single year. During periods of high inflation, families have reported sudden spikes of 10 or 12%. Because moving a frail 80-year-old parent to a cheaper facility is physically risky and emotionally devastating. Families are essentially a captive audience. They just have to absorb the hike. Then there are reassessments. Facilities regularly evaluate residents to see if their care needs have increased. A simple fall, a brief hospital stay, or a slight decline in memory can trigger a reassessment that instantly bumps a resident into a higher, far more expensive care tier. You can sign a contract expecting to pay $5,000 a month, and 6 months later, find yourself billed for $7,000. We also have to talk about the cost of supplies. If the facility provides adult diapers, specialized nutrition shakes, or even does the personal laundry, they often mark up these items at a premium. But the most profound hidden cost falls on the families when the money finally runs out. If a resident spends down their entire life savings and the facility does not accept Medicaid, the resident is facing a forced eviction. They must be moved to a traditional nursing home that accepts government funding, a transition known to cause severe physical decline. The family is left scrambling to navigate a brutal Medicaid bureaucracy, realizing that the inheritance they thought they were building has been completely transferred to a corporate real estate portfolio. Why is the system built this way? Because it perfectly reflects a distinctly American approach to aging: privatize the profits and socialize the eventual catastrophe. The assisted living market operates on the logic of consumer choice. It treats elderhood not as a universal health condition, but as a lifestyle product you buy. The amenities, the chandeliers, the pudding greens, the grand pianos in the lobby are designed to convince adult children they are buying their parents a luxury cruise. By keeping assisted living classified largely as a residential model rather than a medical one, operators avoid the crushing regulatory oversight and staffing mandates that govern nursing homes. This allows the industry to keep labor costs artificially low while charging premium healthcare prices. The government benefits from this arrangement too. By letting families exhaust their own private wealth on assisted living, the state delays the moment when it has to step in and pay for Medicaid. The families carry all the risk. They take on the inflation risk, the longevity risk, and the healthcare risk. And as the baby boomer generation continues to age, bringing an unprecedented wave of dementia and frailty over the next decade, this private pay model is on a collision course with reality. So what is the reality of the assisted living industry? It genuinely provides a necessary bridge between total independence and a clinical nursing home. For those who can comfortably afford it, it offers socialization, safety, and a dignified environment. It keeps people out of hospitals and gives adult children peace of mind. But the economics of this industry are brutally regressive. It is a system engineered to systematically extract middle-class wealth, transferring the equity of family homes into the portfolios of institutional investors. It relies on an underpaid workforce to deliver on the promises made by glossy marketing brochures, and it leaves families completely exposed to arbitrary price hikes at a time when they are most desperate. Ultimately, the American assisted living model forces families to buy their way out of a broken long-term care system, 1 month and one care tier at a time, until there is nothing left. We have turned aging into a luxury good and left the bill entirely on the kitchen table. If this breakdown helped you understand the financial machinery behind aging in America, please like the video and subscribe to the channel. Thank you for watching.